Good afternoon, friends and partners. I'm here with you today on behalf of the National Health Service of Ukraine team with our traditional weekly briefing. I'll start with an important announcement of my decision to step down as the acting head of NHSU and return to the position of a deputy head. It's been a tremendous experience and honor to drive one of the most important reforms in Ukraine to this milestone, and I express my gratitude for the trust and support to the NHSU team and all partners that made this happen. You never walk alone. A respected and experienced member of our team, Dr. Andre Velensky, assumed the leading role in NHSU, while I'll be supporting him in every possible way as his deputy. Importantly, such a decision comes as a consensus reached by all key government stakeholders, aiming at the continuation of healthcare transformation. We remain as one team that will keep on doing its utmost for the best interest of all Ukrainians. Last but not least, we demand honest, transparent and comprehensive competition for the head of NHSU as soon as the quarantine restrictions are lifted. Now I'm coming to the next part of the briefing, implementation of the program of medical guarantees, namely the results of the program for the period of 5 months. As of now, the National Health Service of Ukraine has contracted more than 3,000 providers of medical services, including 1,643 primary care facilities, representing almost 100% of the network. 1/3 are private providers, 25 emergency centers, 1,657 medical facilities that provide specialized care, almost 99% of existing network. 4% of the total are private. The NHSU has paid 38 billion hryvnias, or $1.5 billion, to these facilities for providing services under the program of medical guarantees, covering all types of care. If to be more specific, PHC facilities received 11.8 billion of hryvnias for the period from January to August. Specialized healthcare facilities got 23.4 billion of hryvnias in April-August, and emergency centers 3 billion for the same period. Healthcare facilities that are designated for COVID-19 response received in total 3.5 billion of hryvnias for the period of 5 months. To receive medical service within the program of medical guarantees, a patient needs to receive a referral from his doctor. To date, doctors uploaded approximately 7 million electronic referrals in the e-health system. As of now, 3 million of e-referrals are closed, which means that the patients received the required service. Financing of inpatient and outpatient services for the acute myocardial infarctions, strokes, obstetrics, neonatal care, and endoscopic interventions for the early diagnosis of cancer have been selected as priorities within the program of medical guarantees. Thus, for the period of April-July, over 225,000 patients received necessary interventions within these services, and the facilities contracted for these services received over 2 billion hryvnias. Financing of priority services accounted for 10% of the total payments made. All in all, the NHSU is doing its utmost to move forward to universal health coverage for all Ukrainians, and we will keep you tuned with our further activities, achievements and plans. Thank you for your attention and see you at the next briefing.